Hi everybody, welcome to Healthline. I am Grigoryan. So spring is here. Are you spending more time outside with your family? Have you put your phone down, turned off your computers, got off the TV, and are you outside enjoying nature? Are you breathing in? Are you breathing out? The great thing about spring is also getting rid of things that you don't want to bring with you throughout the year. It's about spring cleaning, and here at Healthline, what's important to us is kind of like spring cleaning your health. So if there's things that you promised to do in the beginning of the year and you haven't, just make a new agreement, set a new intention, get your health on. Every time you have a soda, why don't you move that away and have a glass of water? What? Every time you reach for a cookie, have a carrot. It's just about baby steps to living your most healthy life. Now, spring has sprung. It's May, the beginning of May, and May is the month of purple, which is Stroke Awareness Month. Do you know the signs and symptoms? Do you know what be safe means? Do you know anyone that has suffered from a stroke? Let me give you a couple statistics. More than 140,000 people die each year from a stroke in the United States only. Stroke is the leading cause of long-term disability in the United States, and each year approximately 795,000 people suffer from a stroke, and 600,000 of these are first-timers. Over 185,000 of those are people that have been taken out with a second stroke. When I mean taken out, they suffered from the second stroke. So to share with you all we need to know about stroke awareness, from Glendale Adventist Medical Center is Dr. Mikayel Grigoryan, medical doctor and interventional neurologist. Welcome, doctor.
Thank you very much. It's a pleasure and an honor to be here.
It's great to have you here. Now, when we first started talking, I said interventional neurologist. What did you call it?
I call it brain plumber because it's easier to explain it in layman language what exactly it is I do.
Doctor, what is a brain plumber?
A brain plumber is a doctor who emergently rushes to the hospital that has a patient with acute stroke that is ill, and using minimally invasive techniques punctures a hole in the groin and goes all the way up from the groin to the brain under x-ray and pulls a clot out of somebody's brain, much like the plumber removes a clogged clog from a clogged pipe.
Well, here's my question, because we already have to go into our first break. Why would you puncture a hole through the groin and go to the brain? Why don't you just go through the brain?
Very good question, because it's the safest area where the artery, a blood vessel, is easily accessible, and it also positions the physician far enough from the equipment in order not to create conflicts with the equipment that is taking pictures at the same time.
So it's safe. So we have an artery or vein that goes from our groin all the way up.
Correct.
And what is that called?
The artery that we puncture is called femoral artery. We go through it all the way into the aorta, which is the main vessel in the body, and from the aorta arise the vessels that go to the head. It's like a system of highways, and when I always explain to stroke patients what happened to him, I use the example of Los Angeles highways, for example. Pretty much I'm taking Highway 2 and going all the way to 105 that leads to the airport, if you want that example.
No, I love that. So kind of like if somebody suffers from a stroke and they have to go through through rehabilitation, they just have to learn to go down a different street to get to the same house.
Exactly.
Okay, so more with Dr. Grigoryan when we come back. And here's the thing, take a moment and celebrate your femoral artery. More and all you need to know about stroke, signs and symptoms. Don't go away. Welcome back to Healthline. It is May, and May is all about Stroke Awareness Month. Get your purple on. But before we dive into that, Glendale Adventist Medical Center is going through its own spring cleaning of its own. Did you know that GMC is part of a 20-hospital system called Adventist Health in California, Oregon, Washington, and in Hawaii? GMC's new name will be Adventist Health Glendale. Now, if you haven't already seen, you'll be seeing billboards and commercials promoting this new name, a brand that you've got to keep your eye out for. They're still your old friend with just a brand new name. It's kind of like a health facelift. Now, before the break, we were talking a little bit about what a stroke is. And joining us is a brain plumber from Glendale Adventist Medical Center, Dr. Mikayel Grigoryan. And I'm seriously hanging on to my femoral artery more than ever. Doctor, some of the statistics, strokes. More than 140,000 people die each year just in the United States. And then I mentioned that there were 600,000 people that have first attacks, and then 185 are reoccurring, and that's approximately close to 800,000 people a year. Why so many? What are we doing?
Actually, that's a very good question. The international and the national community of physicians have dedicated incredible amount of research into the stroke, because stroke used to be the second leading cause of death in the United States, and a lot of the efforts were done to drop that number. Actually, at the last International Stroke Conference, it was announced that stroke is now the fifth leading cause of death. However, it still remains the leading cause of disability in the country, as you have very appropriately mentioned it. And efforts, we've achieved tremendous strides in the treatment, acute treatment of stroke, but very important is the prevention of stroke. And we are not doing enough yet to prevent strokes and educating the general public, because there are still a lot of people who don't know what the warning signs and symptoms of stroke are and what can be done to prevent stroke. So there are a lot of community efforts done everywhere in the country in order to intensify this teaching and help people understand how to prevent stroke, and also, very importantly, what to do if you have any signs of symptoms of stroke.
And we'll address that, because earlier I said be safe, which bottom line is we all need to be safe, but signs and stroke, sometimes in strokes of symptoms used to be fast, but now it's be fast. And I'll break that down in our next segment. Doctor, what is a stroke?
A stroke is a sudden onset of neurological dysfunction, which could manifest itself as sudden weakness on one side, sudden numbness on one side, sudden severe unexplained headache, sudden loss of vision, sudden difficulty speaking or understanding what others tell you, as well as less common but very frequently missed, sudden loss of balance. All of this means that there is either a blockage in one of the vessels in the brain that temporarily, and if nothing is done permanently, alters the blood supply to a particular part of the brain, or there is a leak, a rupture of a vessel, which is called hemorrhagic stroke. There are two kinds of stroke: ischemic, which is from the blockage of a vessel, and hemorrhagic, which is usually from a leak and rupture of the vessel. Ischemic strokes by far are more common, about on an account of 4 to 1, and that's why typically when people talk about stroke, they actually mean the ischemic stroke.
And you've said a couple times, though, you said sudden. So anybody can be walking down the street, being at home, doing whatever, and have a stroke.
Absolutely. That's why it's so important to teach people to recognize, because stroke doesn't wait for particular time. Stroke doesn't wait for particular settings in order to occur. It can happen during the sleep. It can happen anytime during any kind of activity or inactivity. And you have to be ready to recognize the stroke, because the window of treatment of something we can do for acute stroke is very small. And that's why it's very important to recognize it timely.
And when I address the symptoms next segment, the T for be fast is time loss is brain loss.
Exactly.
We were talking before we started, and one of my favorite people here who has been on Healthline years ago from the Stroke Center, Michelle Jackson, we were talking about a young boy that was on the show who he suffered stroke when his mom was pregnant with him, in utero. Now, how does something like that happen?
It can happen because there is a temporary cessation of flow to the brain of a newborn or a fetus. It can happen for many different because of many different risk factors. And we certainly see this is a very common misconception, that stroke is a disease of the elderly, which is not true. Stroke can happen, although to a less degree of frequency in virtually any age. There are age-appropriate risk factors. Many times we don't even find the cause of stroke, and we label it cryptogenic stroke, which means we don't know why the stroke exactly happened. There is a thorough workup that, sometimes we do find the cause, sometimes we do not, but stroke can affect any age group, any gender, and any person of any occupation.
Are we that fragile? Because I know there's, even to the point of like when they say a baby's resilient. Are we human beings physically that fragile?
I don't think it's a matter of, I mean, of course, we are fragile overall. However, when it comes to stroke, 90% of the strokes are actually preventable. And there were global surveys, worldwide surveys, that were done in 2016. They are published in one of the most famous journals in medicine called Lancet, that show that across the world, there are about 90% of strokes that could be prevented with proper education, with changes in the health of the individual, and changes in the climate, and so on and so forth.
And that other 10% is just your physical makeup?
Yes.
Are strokes hereditary?
There are particular syndromes that predispose you to risk factors of having a stroke.
Such
the
as?
stroke in and of itself, there are hereditary diseases that make your blood thicker.
Okay.
There are hereditary diseases that make your cholesterol high. In many families, hypertension and diabetes, although not hereditary per se, they tend to run in the families, and hypertension, high blood pressure, and diabetes, high blood sugar, are known, notorious, very preventable, and very ominous risk factors for stroke.
And I also want to address obesity when we come back, because here's the thing. If you wake up one day on your couch and you are 25, 30, 40, 50 pounds heavier, it didn't just happen. And people think, like, I don't know how this happened, but it did. And I like that you said 90% of all strokes are preventable.
That's true.
Okay, so to find out what you need to do to be in that 90%, take a deep breath in, and a deep breath out, have a glass of water, get a carrot stick, and come back, because our mission here is to give you all you need to know to keep you and the ones you love healthy. Do not go away. Welcome back to Healthline. I am Gregory Zarian. Joining us is our brain plumber, Dr. Mikayel Grigoryan from Glendale Adventist Medical Center. Doctor, before we dive into what the signs and symptoms are and what be fast means and what you need to know about being there for the one you love if they are suffering from a stroke, give us some of your medical history.
Sure, with pleasure. I was born, raised, and finished medical school training in Yerevan, in Armenia. After that, I completed a neurology residency training in Moscow, in Russia. And after that, I came to the United States to do research fellowship at University of California, San Francisco. After doing that for a few years, I decided to pursue the residency training again, because that was the time when the neurointervention, which is the name of my subspecialty, or brain plumbing, so to say, just became available. There weren't even fellowship trainings then, but it was the new up-and-coming, very cool, so to say, and very, exciting and very rewarding, highly rewarding subspecialty. So I did my residency training here again at the University of Iowa, followed by 2 fellowships, stroke fellowship at Stanford University and neurointerventional or brain plumbing fellowship at the University of Minnesota.
I love brain plumbing, and our brains are so complex
and so fragile.
We back to being fragile. So, if someone is suffering from a stroke, signs and symptoms, and we've talked about it a lot on Healthline, and it used to be fast, it's now be fast. Can you break down for all of us what be fast means?
Absolutely. So I'll begin with fast. The traditional understanding of stroke was that it always manifests with weakness. There were even scales designed to help paramedics and family loved ones recognize a stroke, and they all revolved around weakness. That's why fast is, to break it down, it's face for face weakness, arm.
So, but when you say face weakness, if you were with someone or even by yourself, and like a side of your face is drooping. It's lost some muscle control.
Correct.
Okay.
Most commonly, it actually is recognized if somebody is eating. You'll be surprised, there are a lot of strokes that come to us right after or happen during the dinner time.
Okay.
When family sits around and they say, Grandma all of a sudden started drooling out of corner of her mouth. Sometimes it's not very easy to recognize the facial weakness, but you're absolutely right. It's the droopiness of the face.
The droopiness of the face, and it could be left side or right side.
Either side.
Okay, and then we have A.
Which is arms. Which is probably the most commonly affected and commonly seen symptom of stroke. It's the arm weakness.
So break that down. So my face is not drooping, And then you would then ask me, hey, can you please raise your arms?
Can you please raise your arms? And if there is a gross asymmetry, meaning one arm is performing much better than the other out of blue, that was not expected in the absence of immediate antecedent injury that just happened, that is most likely the sign of a person is having a stroke.
Okay, so with my arms going up, this is okay. But if
Yes.
this arm goes up well and this one is struggling,
Or
that
doesn't move at
or
all.
doesn't move at all, so it ends up being very limp, that's a reason to pause. Okay, the next one is S.
The S stands for speech, and speech can be a sign of either the left-sided or right-sided stroke, even though the language center in the vast majority of us is on the left side of the brain. There are people who have the language center on the right side of the brain, and also people who have the stroke on the right side their speech can become very slurred. So it's either the sudden inability to speak, understand speech, or the speech comes out very slurry, or people talk gibberish and or mumble. Exactly.
Okay, and then the last one is time, and as I said earlier, time loss is brain loss.
Absolutely. Time summarizes all of these symptoms, and basically it's a call to action. You recognize those symptoms. Remember that every minute, we have a manuscript actually that calculated that every minute we lose about 1.9 million neurons, and every hour we have stroke, our brain ages 3.6 years after every hour of stroke not being treated. So that's why we always stress time. When doctor goes in to treat stroke, they literally drop everything and run to the hospital. And the same should be told to the family. When you see your loved one is having a stroke, don't waste any single second. Don't call your friend, don't call your primary doctor, call 911.
Now, speaking of calling 911, and then I want to go back to address the B. 3 hospitals locally in the area, but Glendale Adventist Medical Center is the only comprehensive stroke center. What is the distinction?
Comprehensive Stroke Center is in a nutshell, it's the stroke center that can take on any kind of stroke.
Any kind, okay.
Ischemic or hemorrhagic, small or large, severe or mild, and that possesses every single tool and technique to treat every kind of stroke, and on top of that, monitor that kind of stroke, because every patient with a stroke initially, who undergoes intervention, initially needs monitoring in the intensive care unit. And intensive care unit, proper neurological intensive care unit, is a very cumbersome piece of the puzzle that is not readily available in a lot of institutions.
But then it also goes back to what we just talked about, time loss is brain loss. And you can go to a hospital that is not, and it's not insulting any hospital, it's just,
of course
you want to go to somewhere that's comprehensive. So let me just say this to you right now. Where you live, find out where your certified comprehensive stroke center is, so you know exactly where you're going. Because if you get into the hospital, into the ambulance, they're going to take you to the closest hospital. But if you are with someone that you love and you say, no, please take me to GAMC, it's comprehensive, they're going to take you there.
Correct.
Know exactly which hospital is best for you and what is going on.
Correct, and that's very important to mention. There is actually an ongoing program that is going to kick in later this year involving the paramedics, because EMS starts playing very important role in the stroke management. They will execute a diversion to comprehensive stroke centers. They will basically assess very quickly a stroke patient, and based upon the severity of the symptoms, they will divert patients specifically to comprehensive stroke centers.
I love that. Hold that, and you know what? When we come back, I'm going to leave you with a cliffhanger, what the BE stands for in Be Fast, Don't Go Away. Welcome back to Healthline. The conversation's all about stroke and stroke prevention and awareness. Joining us from Glendale Adventist Medical Center is our very own brain plumber, Dr. Mikayel Grigoryan. Okay, so doctor, we were breaking down signs and symptoms. It used to be fast, now it's be fast. You broke down fast, so if your face is drooping, or if you cannot raise your arms together, if one is completely numb or limp, speech is off, and time is of the essence. It now is with B before that. What does the BE stand for?
So in order not to miss the subset of strokes that is very frequently missed and is attributed to different pathologies, different diseases. B and E came into the picture. B stands for balance, because the strokes that affect the back of the brain, the part of the brain called cerebellum and part of the brain called brainstem, which actually are the most ominous kind of strokes, because in the back of the brain everything runs so compact that even a minuscule stroke can cause very severe consequences. These people will not necessarily present with your typical symptoms of strokes that we just talked about. They will present with alteration of balance. For example, I all of a sudden started walking like a drunk.
Okay.
And I don't know what exactly happened.
Okay.
Many places people will go to the emergency department, they will say, oh, you're just dizzy, take a medicine, it comes from your ear, probably inner ear problem.
Like your equilibrium is off.
Correct. And E stands for eyes. Many times patients with stroke have what's called gaze deviation, is that their eyes are forcefully deviated to one side or the other. That actually in and of itself is the most reliable predictor of a large vessel occlusion, meaning a large stroke. Those are the patients that would benefit from thrombectomy that we can talk about and we touched on a little bit ago. So a deviation of the eyes usually means that the patient is having a very large stroke.
Break it down again. When you say deviation, what does that mean?
The eyes don't look straight. A person cannot look straight at you. Their gaze is deviated like that.
Okay.
You cannot sustain that on your own, but if you have a particular part of the brain affected, your eyes would be forcefully deviated to one side. That's what E stands for.
Okay, so, and one thing I want to say too though is, so someone suffers from a stroke. You then get to Glendale Venice Medical Center. What happens from the minute that they arrive into ER?
So it's very important to have a communication between the EMS and the hospital. The EMS usually notifies either just the emergency department or the emergency department and the stroke team, and I am part of the stroke team. We receive a pager or a text message saying incoming stroke. That activates what's called a stroke alert. Emergency department knows to expect a stroke, and the first thing that happens to the patient who gets wheeled into the emergency department, assuming they can breathe on their own, they very quickly get a look from the emergency room doctor and then go straight to a CAT scan. CAT scan is our equivalent of an EKG for a heart attack. It allows us to distinguish between the bleeding kind of stroke and a blockage kind of stroke.
So bleeding, real quickly, because let's go back to it. Bleeding is the hemorrhagic.
Correct.
And then the blockage is
the ischemic.
Ischemic, and the ischemic is most common.
Correct.
Okay.
After that, a CAT scan or a CAT scan of the brain, in addition to the CAT scan of the blood vessels, which we also do emergently, allow us to distinguish a large vessel occlusion, meaning one of the main vessels, pipes in the blood is occluded. Those patients would benefit from thrombectomy or from brain plumbing, versus a small blockage. Those patients will benefit from a clot-busting medicine like TPA.
TPA, okay. So just say somebody gets either or. Somebody survives either stroke.
Mm-hmm.
What is their recovery like? I mean, first of all, when you say time loss is brain loss, isn't it the window perfect an hour? Meaning, isn't it best recovery to have about 60 minutes?
For TPA, the TPA should be given according to the national standards within 60 minutes of the patient hitting the door. There is a door-to-needle benchmark. Overall time window during which TPA is effective is up to 4.5 hours after the onset of symptoms. Okay. Beyond that, there is actually evidence that TPA could be dangerous because it runs a small risk of bleeding. It's a clot-busting medicine. For thrombectomy, there is no universal time window because we all have different collateral blood supply and we all are wired a little differently. We usually invariably take patients for thrombectomy who come to us within the first 6 hours, and on a case-to-case basis, we will consider taking patients who arrive to us later than 6-hour window. But still, that doesn't cancel the fact that time loss is brain loss by every means, because every wasted second, literally every wasted second, diminishes the chances of good outcome in a stroke patient, irrespective of treatment.
And depending on how severe the stroke is, that's where your physical therapy and rehabilitation is.
Absolutely.
And also a lot of your physical therapy isn't just done at the rehabilitation center, a lot of it's done at home.
Of course.
Now, I read a statistic earlier that said you can have recurrence of stroke. Is that because somebody doesn't do their physical therapy and get their health better and all that? Why do strokes recur to other people?
Many times it's because of non-compliance. People who have stroke think that they recover and everything is well. Sadly, sometimes they run out of the insurance coverage for the medications and they stop taking their medications, or they simply forget the importance. Certain bad habits such as cigarette smoking, which is a notoriously known risk factor for stroke and in general for clogging up the arteries anywhere in the body. People get out of the hospital and they under-recognize the importance of continuous tobacco abstinence.
Are you kidding me, people? You were just in the hospital for stroke. And it's the same thing as overconsumption of alcohol. It's the same thing as we are the most obese country in this world. And you know, when we've had guests on the show that say, eat lots of fruits and vegetables, eat more green, because if you eat on the inside of what is supplied at the market, a lot of it is refined. Cholesterol, all this stuff that's bad for you. Doctor, what is your comment to people that just go, oh, it's not going to happen to me? Talk to us about eating healthy.
So in the survey that I had mentioned that mentions that 90% of strokes are preventable, one of the, or two of the most common prevention methods to me are the easiest of all. They are moderate physical exercise and healthy diet.
What's moderate physical exercise?
Well, moderate physical exercise is exercising 3 times a week at about 20-30 minutes.
Which is nothing, people. Get up, walk around the block. And if you say you don't have time, you do have time. Park your car a little bit farther away. Walk to work. Go upstairs. Make different healthy choices. And what about diet?
So definitely fried food is notoriously known for increasing it raises your cholesterol, it makes your diabetes worse. Avoid fried food and avoid carbohydrates, a lot of them. Eat proteins and vegetables, what's called Mediterranean diet. And it's funny you mentioned park further away. I always recommend to people, and I do that myself. Let's say I'm about to have a steak in Americana. I park my car about 8 blocks away because I can walk to the restaurant and I can walk back from the restaurant, and trust me, those 10-15 minutes, especially that you want to be walking back, let's say you decided to treat yourself to a juicy steak. It's nothing wrong with that once in a while, but that exercise really helps, and really helps your body digest that food as well.
Doctor, final thoughts in regards to people with stroke awareness?
Please know the symptoms. Please be aware that stroke affects any gender, any age. Please remember that stroke is 90% preventable, and please reach out to any source of information that you can find. There are sources on the internet. There are many, many hospitals and groups that do outreach in the communities. If you want to find more information about to prevent stroke, we're only a click or a phone call away.
And talk to your own doctor. Doctor, it was an absolute pleasure. Thank you so much.
Thank you.
Okay, so here you have it. Signs and symptoms. Be fast. If your balance is off, if somebody's eyes are deviated that way or this way or just off, your face looks like it's drooping, you can't lift both arms together, your speech has changed, you're mumbling your words, and time loss is brain loss. Take these symptoms and signs and pass them on to your family and friends. And here's a few other things too, is write down the medication you are taking, put them in your wallet. Make your family and friends know, because once they're taking you to emergency, be it for this or any other ailment, the doctors and the emergency people need to know what's going on. The last thing you need to do is treat you for something with medication that doesn't work. Know where your local hospitals are. If you need to know where a comprehensive stroke center is, Glendale Adventist Medical Center, Heart Doctor, Heart Center. You are the captain of your own medical ship, so find out where things are. Remember, the most important conversation you're going to have is about you and your health. So why not start here? Get your purple on. May is Stroke Awareness Month. Have a conversation about it. Once again, Glendale Adventist Medical Center is getting kind of like a health lift. Please be on the lookout for our new logo, and please remember you can always find us on YouTube at GAMC Healthline. Follow us on Facebook, at Glendale Adventist, and at Twitter at GAMC Health, and we're also on LinkedIn, Glendale Adventist Medical Center. Have a great night. Pass it on to your friends and family. We'll see you next time.